Good morning, good afternoon, and good evening. Thank you so much for the kind invitation for me to present HIV and menopause. I've titled this Community Perspective because I've called it Patient Perspective and spoken only about myself, but that wouldn't give you the width and the breadth of the things that are happening to us as a community of women living with HIV. In preparation for this presentation, I did consult with some of my peers, mainly from the 4M network of mentor mothers, so that you can get their views as well. The agenda for my slides is very, very short. I'm going to talk about my personal journey, the barriers or challenges that we face as women living with HIV going through the menopause, some recommendations and acknowledgements with a few resources as well in the acknowledgements. So my personal story. I have been living with HIV for over 2 decades. And at the age of 41, I started experiencing menopausal symptoms. I spoke very openly with my HIV consultant, and we both agreed that I should start speaking to my general practitioner. I went to my general practitioner, who dismissed this because I was only 41 years old, and said for me to come back in a few more years, didn't offer me to do any sort of test or even have a conversation, an open conversation about why I would be feeling this way and why, as a woman with HIV, I would be experiencing menopause earlier than the general population. So it's been a very, very long journey for me. I'm now 47 years old. I'm delighted not to now share that early this year, in May, somebody finally listened and I was given HRT. I'm yet to see the full benefits, but some of the symptoms have now stopped. So why do we think that women living with HIV face barriers and challenges when they are going through the menopause while living with HIV as well? I think the history within the medical field is that of women, mainly women, not being heard. So they become very, very reluctant to engage. And it becomes one of those that, let me just concentrate on the HIV. The menopause maybe can wait. Maybe I can power through this. And it's that other thing as well, that women, we take on this caring responsibility, but we are not very good at caring for our own selves. So we look after everybody else, and then we think we'll just power through. We then start having multiple appointments. It's not only the HIV clinic, then we now have to think about the specialist menopausal clinic. And sometimes it's really difficult if you've got other priorities, such as children, such as work, and looking after your family and yourself. The economic factors, financial stresses, getting to one appointment can be expensive if you do not have a job or regular income. Those financial stresses will show up, and you may choose not to go to multiple appointments. Housing. I'm talking about housing in the fact that we know already that some women that have not shared their HIV status will try to hide their HIV medication as best they can. Imagine now having HRT. If you choose to go on HRT, that's another sort of medication that you potentially will have to hide if you're not confident or comfortable about talking about what you're going through. Childcare. It's very, very difficult. I'm a mum, and I find it sometimes quite difficult to take my child with me to appointments, because I don't feel that it's appropriate for me to drag along my young daughter with me, especially when I'm talking about things that involve me going through the change of life. Cultural sensitivity. We know that in different communities, in different cultures, talking about things like HIV, things about sex, is almost looked as taboo. Now imagine having a conversation about dry vagina as one of the symptoms of the menopause. How do you even begin to have that conversation? And like I said, we sometimes look at the menopause as yet another condition. I've already got HIV. And as we age with HIV, we have other co-morbidities. So now going through the menopause becomes almost like oh my goodness, I've got yet another condition. And then this can lead to the social factors of isolation. When you're going through the menopause, so much is happening. You get the brain fog. Your confidence, for me, especially my confidence took a big beating. And I decided to isolate for quite a long time, because I didn't know how to explain to my friends and loved ones that I would just cry for no particular reason, well, for the reason of menopause, but I didn't want them to feel that I'm just crying for no particular reason. With all the things that are happening in the world, war and environmental challenges, we're seeing a lot of immigration. People are on the move. So when you arrive to a new country, trying to navigate the health system, especially in a language that you don't understand, that becomes a huge barrier to even accessing HIV care, let alone something like the menopause, which until recent years hasn't been a hot topic. I'm so glad that it's now becoming a hot topic. And then we have this question, is HRT the only solution? I know that there are doctors and that will say, no, it's not. You can not go on HRT if you think that you're doing it. But as women living with HIV, we now start thinking about drug interactions and pill burden, more medication. Is it going to interact with my HIV medication? If we don't have the treatment literacy to check or to have the confidence to ask our healthcare professionals if there's going to be a drug interaction. The recommendations, what do we think as women living with HIV going through the menopause? If we could find integrated care, a good example is the Sunflower Clinic here where I live, where it's a one-stop shop for women to go and discuss everything, including what's an HIV clinic, but with that, they've got specialists that look at reproductive health as well, including the menopause. We need to continue funding meaningful involvement projects, such as the GROWS project, which looked at growing older, wiser, and stronger for women living with HIV, and they spent a lot of time discussing the menopause. We need to use the tools that we know work, like peer support. For me, when I went onto the gel, it used to make my hands tingle when I applied it. But by talking to my peers, somebody said, ask your healthcare professional for those little wooden things that they suppress your tongue with when they're looking at the back of your throat. So now I literally paste it on with that, so I don't have to touch it. Constant supply of HRT. Currently in the UK, we're experiencing a break in supply chain. So it is worrying that you may start HRT, but there's no guarantee that you are always going to get that prescription filled as and when you need it. We're told that we need to look at alternative therapies, such as exercise, diet, and potentially other drugs to help us go through the menopause in a sort of a positive way. But if you're a woman living with HIV and have other comorbidities, such as inflammation and your low bone density, exercise becomes quite difficult. So I think instead of just saying exercise, it's time that we actually specify what exercise is best. I swim now. I used to be a runner, but I know that my bones cannot take me pounding the streets anymore. So I swim. Empowering women living with HIV with information. It is really, really good to give women living with HIV going through the menopause every single bit of information, talk us through the research that is going ahead, involve us in research that is going on, empower us with this information, because when you do, we will empower our peers and will make this experience as manageable as we possibly can. I've put in capitals, all healthcare professionals looking after us should understand HIV and menopause. Again, without integrated care, there is that gap where your HIV consultant, your HIV doctors, your HIV clinic will know about what you're going through, but your general practitioner may not know. For whatever the reasons are, they may not know. And so that becomes very difficult on who you can share this with and where you're going to get the best support for you. And to the women living with HIV that are going through the menopause, I urge all of us to speak up. Speak up, ask for help. Because when you speak for yourselves, you're not only supporting yourself, you're supporting and talking for all of us. We are a community and we can only get through this menopause by supporting each other. I talked about the Sunflower Clinic. I just wanted to show you quickly their model, and I've circled that they look at family planning and reproductive with the doctor, and they look at menopause assessment, treatment, and advice. And like I said, I feel incredibly lucky that I've got access to this clinic that offers everything that I need in one appointment. I've given you some acknowledgements, the Sunflower Clinic, and also the project that I talked about, GROWS. And a huge thank you to my sisters, both here in the UK, in Kenya and Uganda, that form the 4M network of mentor mothers. I thank you for your time and thank you for the kind invitation.